Welcome, everybody. This is the Rotary E-Club of Silicon Valley, and every week we bring you the story of people who are making the world around them better. We're part of Rotary International, 1.2 million members and 36,000 clubs around the globe. Our particular club you can find at rotary.cool, really. Yes. And by going there, you'll learn a lot about our highly unusual but very flexible model. And not only are we online, we are asynchronous. Our members are all really busy people who have a heart for service, but want to be able to take in a meeting each week at the time that works for them, and that's part of who we are. As a part of this flexibility, we get to connect with some wonderfully interesting speakers all over the globe. And today we are talking with Assad Haffar and Marlene Spencer of the World Federation of Hemophilia. This is an organization that works to ensure that every person with a bleeding disorder has access to safe, effective, and sustainable care, no matter where they live. Around the world, thousands of people with bleeding disorders still face lifelong pain, disability, and even early death due to a lack of diagnosis and treatment. So being able to hear about the important work being done by the World Federation of Hemophilia is a special opportunity for us to share something to our audiences, and we are very pleased to have you both as guests today. Welcome to the Rotary E-Club of Silicon Valley.
You, Rushton, and hello, everyone. My name is Marlene Spencer, and I serve as the head of corporate and community partnerships with the World Federation of Hemophilia. We also go by the acronym WFH, so you will hear us say WFH a bit. I also serve as national director for our U.S. affiliate, which is WFH USA. And so that's our affiliate that's in the U.S. that allows us to connect with the U.S. community and give the U.S. community the opportunity to support and support the work that we do at the World Federation of Hemophilia. Now, it is a pleasure to join, and my colleague, Dr. Assad Haffar, our Medical and Humanitarian Aid Director as well. Now, we first connected with Rotary through the international convention that took place in Calgary earlier this year. And we were very touched by Rotary's global commitment to service. Today, what we would like to do is share how that same spirit of service can help us to close the treatment gap for people with bleeding disorders around the world. Now, to begin, I am going to turn it over to Dr. Haffar, who's going to walk us through basically what are bleeding disorders and the human impact of limited access to care and how WFH is working to change that reality. So, Assad, I turn it over to you.
Thank you very much, Marlene, and good day to everybody who will be watching us and watch this presentation. We're really very pleased to be here with you today, and I hope that we're going to give you an idea about what is hemophilia, the work that the World Federation of Hemophilia does, and how we can cooperate together to improve the life of the people with hemophilia around the world. I would start first by just introducing hemophilia to you. So hemophilia is a lifelong condition where the blood simply doesn't clot properly. You know that if you cut yourself, you will find a clot at the end that is going to stop the blood from going outside of that laceration or that cut. In hemophilia patient, this does not happen, let's say, swiftly, or it doesn't happen at all. Now, the problem here would come if this happens internally, because externally you can see that. But if it happens internally, like intra-abdominal bleed or intracranial bleed, that might be lethal and might lead to the deaths of the patients. In fact, this is a genetic disorders. It's a recessive genetic disorders where usually the female are the carrier of this gene, and they transmit it to their male children. So the females usually are the carriers, and the males are the people who will be affected. There is no cure for that because, like I said, it's a genetic disorders. So we usually, what we do is we try to treat the complications. Now, the genetic is gonna, or the genetic disorders is gonna lead to a loss or the absence of one of what we call clotting factor. So we usually do the replacement of this absent clotting factor. Next, please. If we look at the challenge of these disorders, unfortunately, in most of the countries and most of the people, we find that 75% of the people around the world are not really diagnosed. So at the World Federation of Hemophilia, we know from our statistics that maybe now there are around more than 200,000 patients around the world, but we would estimate that there are more than 800,000 around the world. So about 3/4 of these are not diagnosed. What is more important is out of these diagnosed people, only 8% diagnosed in low-income countries. So these even face more challenges and more problems in their daily life. And of course, the care in the low-income countries lags 50 years behind standards available in the United States and even more. And that's going to be illustrated to you in the next slide. This is a slide that shows two photos. The one on the right is Prince Alexei of the Tsar of Russia. It was taken in 1916, and that Prince Alexei had the hemophilia disorder, and it led to this contraction in his right knee, left knee, sorry, that you can see in the photo. The guy on the left side, it was taken in 2015 by myself when I was visiting Bamako to see some patients, Bamako in Mali. And this guy reminded me exactly of Prince Alexei, the way that he was walking, the way he was standing, and the way even he was dressed. I just compared the two photos, and I concluded in 100 years, nothing changed for the people with hemophilia and the children with hemophilia in developing countries. Now, what is the effect of this? And we can see this on the next slide. People with hemophilia felt a lot of isolations. They had a lot of social psychological changes. They faced even limited education, employment opportunities, and that led to losing full trust in the international hemophilia community, like us, like the World Federation of Hemophilia. And I'm going to show you another example here. With this nice guy whose name was Gideon from Kaduna, from Nigeria. When I visited Nigeria the first time, I met with him, and he presented me with this cartoon on the right side of the screen, where it says, "We love you," because we were helping the people with hemophilia in his country, in Nigeria. And that's myself in the photo with him, Gideon, his mother, and his father. If we move to the next slide, unfortunately, 4 months after following my visit, Gideon was hit by a truck. He had an intracranial hemorrhage, and that's what I mentioned earlier, that it is a lethal one. He stayed in a coma and passed away 2 days later due to the lack of treatment products. There was no treatment to treat him at that time. That's really affected me, affected the hemophilia community. He was a young person full of life in front of him. Another example that I would show you also from the same visit to Nigeria, and this is David from also Abuja in Nigeria. And because of the
Yeah,
hemophilia,
that's great.
that
You could
affected his
go
both
back a
knee
little
and
bit.
both hips. He cannot stand, and
Okay, that's enough. Thanks, David.
mobility is very much restricted. If we move to the next slide, when we identified David, we managed to send the treatment product that could help him. So with this, although he cannot now stand completely erect, but at least his mobility is much better. And he managed to join the university, and he just recently graduated as an engineer. If we play the video, you will see how he is now just walking very fast on the stairs. So these are two examples from one country, which is Nigeria, how things happens and how things happen and how they can change. Next, please. The last one is a testimonial from a child whose name Isaac from Uganda. Also, he managed to go to school. He managed to graduate from his junior school. You see him here in his nice outfit, holding his certificate of his junior school. And he sent us a very nice letter thanking the WFH for helping him with the treatment in order to continue his junior school and graduate. I give it to you here, please, Marlene.
Thank you, Assad. Those stories, I would say, they really show both the urgency and the possibility of change when treatment becomes available. I'll take a few minutes now just to walk you through and share just how WFH is working to address some of these challenges globally, more so in low-income countries and in parts of the world where there is no access to treatment. And just also how or where Rotary's values, I think, align so naturally with the work that we're doing. So we are actually in the midst right now of just finalizing our next 5-year strategic objectives. And these are 4 of the areas in which we are focusing on. So one of them is around strengthening standards of care for access. And this is where we use our data collection programs or humanitarian aid program as well, which Assad spoke about, as well as education to strengthen global standards of care and ensure that there is consistent, equitable access to care. We also work to build local capacity. And what that means is we work in 151 countries where we have we call them national member organizations. These are patient organizations in these countries. And so we work to empower these organizations as well as the treatment centers. There are treatment centers that treat people with bleeding disorders. And so we work to empower these people that are within these centers as well as the member organizations so that they're able to deliver sustainable and high quality care. We also lead global advocacy, and what that means is we drive policies and mobilize the resources that we have so that we're able to expand access to treatment and to care. And of course, it's also important, for there to be transparency and for there to be trust as well. So we promote product safety, transparent information sharing, and partnership as well for a greater collective impact. Now, I spoke a little bit of partnership, and of course, none of this happens in isolation. It is basically made possible through partnership, and that's where I think Rotary comes in. Rotary's global reach complements our expertise, and I think together we can transform access to care. As I mentioned, some of the things that you could do is, for example, raising awareness through your clubs, something similar to what we're doing here today, as well as supporting some of the local projects that we're working on. As well, one of the things that we're also working on is to see how we can access Rotary Global grants as well to help us with diagnostic and training initiatives so that we can, be able to help to work in these parts of the world where people are lacking access and help bring better care and treatment to them. And so with that, I want to turn it over to you, Assad, just to give one last story, just to show in terms of, when there's access to treatment, what that means.
Yeah. You remember the story that I just told you about Gideon and how we were affected by his death 4 months after we met with him in Abuja, the capital of Nigeria. Of course, the cause of his death was the lack of treatment. Now, how the presence of treatment can help? Elia, who is from Enugu, Nigeria, also, it is a city in the south of Nigeria. He was almost the same age like Gideon. He was also hit by a truck, and he had intracranial bleeding and went into a coma. There was no treatment available in Enugu, the same city. However, because this happened a few years after, we managed to build the good expertise and the good management and the treatment products in the country. There was product available or treatment available in the north of the country in a city called Kano. The society managed quickly to mobilize the treatment from Kano in the north to Enugu in the south to treat Elia while he was in coma in the hospital in Enugu. And this helped him to recover and get back to a healthy environment and go back to school.
Thank you, Assad, for sharing that story of Elijah. And again, as I mentioned, this is just to show how when there is access, when we work together, how, we can help those patients that are living in parts of the world where they don't have the access to the treatment and care that we have in these parts of the world where we are living. Now, of course, from our stories, you'll see that this is an urgent, it's an urgent issue. However, it is a solvable problem because there is treatment. And, Rotary has shown the world what is possible through commitment, I think, where you've eradicated diseases and helped to transform lives. And I think working together, we can do the same for people with bleeding disorders. WFH, again, we have the knowledge, we have the strategies, and there is treatment. And I think together, we can work collectively together, whether it's through awareness, collaboration with local partners, or, through projects, through Rotary Global Grants. I think every effort helps to bring us closer to treatment for all. And, this is how we can work together and, be the catalyst, I would say, for change. And with that, I will turn it over to any questions that you may have, or turn you back over to Rushton.
Thank you, Marlene. Wow, very, very powerful stuff. I'm excited for us to talk about this. Although first, I want to introduce the group that we have got on the recording. In addition to Assad and Marlene, we have three members of the Rotary E-Club of Silicon Valley. First, in Vancouver is Nick Lagarde. In Eastern Italy is Cecilia Babkirk. My name is Rushton Hurley. I live in San Jose, here in the San Francisco Bay Area. And I am very much ready to jump into a bunch of questions. So let's start with this. You talk about these rather amazing statistics, about like, okay, 200,000 people have been diagnosed, but the estimate is that there's another 600,000 people who have yet to be diagnosed. Is it the case that there are degrees of hemophilia that mean that someone who is not diagnosed may suffer a set of issues when they encounter certain things, but tend to make it through? Or is there one level of hemophilia that essentially means that an undiagnosed person who has what otherwise might be a fairly simple injury, quite the life-threatening situation?
Well, in fact, the people who are not diagnosed are always in danger of losing their life, because if you are not diagnosed and you have the severe form of this disorder, you will have you are always in danger of having a simultaneous bleeding, and these bleeds can come in either in the skull as intracranial bleed, in the abdomen, in the muscles, in the joints. So when you have this in one of these life-threatening area, let's say, the person is always in danger of losing his life because of the bleed. If it comes in the joint, it's going to be very much painful, and with time it's going to destroy the joint. And we've seen a lot of patients who needed total joint replacement, like total knee replacement or total elbow replacement, because of this bleed that happened in the past in their life.
So essentially, one further argument then for the work that the WFH does is that by properly working the kind of treatments that you make available it lowers the cost of healthcare in areas because they're not dealing with more severe things that are preventable via the treatment. Is that accurate?
Exactly, that's what's happening. Because if we treat, because in developed countries, hemophilia is treated as an outpatient as an outpatient.
Mm-hmm.
But in most of the developing countries, you cannot treat this patient as an outpatient. You need to admit the patient because usually they don't have the required treatment products, which is the replacement of the missing factor, like factor 8 or factor 9 of the coagulation cascade or the coagulation factor. And once you admit this person is going to occupy a bed, occupy the time of a physician, the nurse, and all that. So there are a lot of indirect costs that is adding to the cost of the treatment itself in developing countries. So when we have the treatment available in the emergency room, you don't need to admit the person, and that will really decrease a lot the indirect cost of the treatment.
So that leads us kind of into the question that Cecilia had in the chat, and she's asking about the nature of the treatment. Can you give us some more detail about what someone who has a bleeding disorder might expect out of the kind of standard treatments that are available?
So with these genetic disorders, it leads to the missing of one or more of the coagulation factors. And these factors come from number 1 to number 13. The most frequent one or the most prevalent one is what we call classic hemophilia, which is the absence of factor 8, where we call it hemophilia A, or factor 9, and we call it hemophilia B. So when the person experiences a bleed, the simple treatment is to replace the missing factor. And these are medications that contains concentrate of the factor 8 or the factor 9 that is being given intravenously. Now, with more and more, let's say, scientific advancement, there are now some other medication, we call it bispecific antibodies, that would take the role of factor 8, for example, and is being administered subcutaneously.
It sounds exciting that there are these, you talked at one point in the presentation about the lack of progress over 100 years, but it sounds like the last decade may have seen some real breakthroughs.
I would say we are now living, let's say, the golden days for hemophilia because there are more and more now treatment that are available in the market. However, unfortunately, the treatment is still quite expensive. So it's available in the developed world, but it's not available in developing countries. And that's why we need to have more and more efforts together to make sure that every single patient, wherever this patient lives, get the proper treatment he deserves.
So often when that is the set of circumstances, when there is a really expensive medication out there, and it affects people globally, there is a process. A process probably makes it far more organized than it is. A pattern of having drug development entities in places like India and certain parts of Africa take on being able to create and produce these medications at lower costs. Is that in process for how things work with hemophilia?
It is not exactly because what's happening in other, let's say, classes of medications where we call about generic medications or generic drugs, it's not exactly the same in hemophilia because we need always to make sure we keep the efficacy, the safety of these medication, and that's why doing the generic, let's say, medication is not always practical or available.
Okay, got it. Nick asks if there are promising efforts happening to bring these costs down in some way.
One of the most important things to bring the medication down is to have it more and more available around the world because the more you produce, in theory, the cost of production of this medication is going to go down. And that's why these efforts must work together in order to ensure we produce more and more of these medication in order to make sure that the price goes down.
Okay, two more questions for you before we wind things down. The first is from Cecilia asking if you are working with large foundations, the Gates Foundation, for example, that has shown a lot of interest in these kinds of projects around the world, but I'm sure there are more projects than they have addressed. Have you had those kinds of partnerships?
We tried, and I will defer this question to Marlene to talk about it.
So we've tried in the past. We haven't had much success there, just based on. I think this was during the time of when gene therapy was more so in trials per se. So we haven't had much success there, but we're always working and trying to find ways that we could connect to some of these foundations. And so if there's any way where someone could leverage a connection for us, or get us talking to the right people in, let's say, foundations like the Gates Foundation, that's something that we would more than welcome and would be happy to work with you on in making those partnerships. Because again, that's when we talk about partnerships, this is what we're talking about. And the more we're able to partner with various organizations that are doing some of the same things in terms of alignment, it may be towards something else, but the work is similar. Where there is alignment and we can make those connections, then definitely we welcome that.
Well, that's a good segue to the last question. So Rotary is a distributed organization of many, many thousands of clubs. If a club has a particular interest in assisting, what does that end up looking like? So let's say a club in our area, in the San Francisco Bay Area, wants to help in some fashion. What is kind of the natural way a club that might be raising anywhere from a few $100s to several $1,000s, might be able to assist in specific efforts that the WFH is working on?
Well, I mean, I think there are several ways that clubs could assist. So, starting with what we're doing here today, we talked about the raising of the awareness. So, I think that's key, because the more people are aware of this, the more we're able to secure, some of the help that's needed. In addition to that, I mean, we have several projects. So, for example, I'll give one is or International Hemophilia Training Fellowship, where we bring a fellow, a youth fellow from a developing country, and we bring them to a developed country where they're able to learn, to get educated on some of the ways in terms of how hemophilia is treated in the developed world, and gain more expertise so that they're able to go back to their countries and they're able to implement as well as share those knowledge. Now, that is something that, let's say it costs somewhere between maybe 7,000, let's say, per fellow. So that's an area where, a club, let's say a local club, would be able to help us to do that. In addition to that, I mean, there are several other programs that we have. And one of the things that we've been trying to do is trying to connect with also Rotary clubs that are in some of these developing countries that we're working, where they have boots on the ground, and to see if there are ways that would allow us then to be able to access some of your global grants to be able to do on a more larger scale project, I would say, on the grounds. And Assad could speak to more to some of those projects, because again, he is more so out there in the field in terms of some of those projects. But I think it starts anywhere, as you said, from a couple of hundreds to a couple of thousand, helping us with, let's say, a fellow. To bring a fellow to a center in the US, for example, to get that fellow trained, or, boots on the ground, we're able to access some of those grants globally that will help us to really build the capacity for one, and really help within some of those countries on the ground.
Yeah. I just would like to add, I've been now in this hemophilia world for 25 years, more than 25 years. I've been working for the Federation for 25 years now. And I would just say every help is important. Whatever you think your help could do, don't just, oh, that's small thing. No, come to us, please. And every dollar counts. That's my experience in this. So whatever people out there can offer, don't say, yeah, that might be too small for this. It might not going to help. No, let us judge this because the the idea is the concerted efforts. We work all as unity, and whatever you give is going to be added. That is going to help to add to others, and is going to help at the end the hemophilia community in these countries.
That's a wonderful spot to end on right there. Assad, I mean, it is very much a Rotarian audience that is going to enjoy that message of you can make a difference, however much it might be. Now, all of you who have been watching this recording or listening to this podcast, we want to thank you for taking your time. The opportunity that we have as a club to regularly be inspired by these people who talk to us about the work they're doing, to find ways to be of assistance to the kinds of great efforts, the innovative efforts, the sustainably interesting efforts that are going on out there. We are excited to be part of that. And we are excited that you have joined us in sharing those stories today. We hope you will share this recording with others and you will take a look at our website at rotary.cool. Click on the meetings tab to see our archives and see the many stories of people making a difference in the lives of others that we're very happy to share. As we always like to do, we hand it back to our speaker for the final word. So, Marlene, how would you like to finish us off?
Well, thank you again, Rushton. I mean, we want to thank you for having us. It is great to be able to speak to this audience and just to share as much as we can about the work that we're doing. Again, our invitation, I think it's simple today is, again, help us to close the treatment gap. As I said earlier, whether it's through awareness or collaboration or, with our local partners, support for our projects through, your global grants, for example, every effort, as Assad says, helps to bring us to treatment for all. Because at the end of the day, what we would like to do is to have treatment for all. We want to make sure that those people that are in the developing world are able to access the same treatment that we are able to access in the developed world.
Wonderful, Marlene. Wonderful, Assad. For all of our listeners, viewers, WFH.org will get you more information about the great work being done by the World Federation of Hemophilia. And we thank you again. We will see you next week.